Thank you, everybody, for joining us today. My name is Dr. Komolafe. I'm excited to be here today. On behalf of UB Health, we'll be talking about self-care and population health management. My name is Dr. Ronke and today I will be presenting with my colleague, Rey Davis. Rey Davis comes from Banner. She is the Senior Manager for Population Health Management, and she'll be talking to us about self-care and population health management and how to better manage your value-based payment arrangements in order to achieve positive care outcomes. So when we talk about self-care, what do we really mean? World Health Organization defines self-care as the ability of individuals, families, and communities to promote health, prevent diseases, maintain healthy lifestyle, and engage with your provider system, with your provider prescriber. So what are the scopes of healthcare, self-care? Self-care, the scopes of self-care really encompasses several elements. That includes health promotion, disease prevention and control, self-medication, and providing care to a person. But what do we truly mean by health promotion? Does it mean we go to the provider office and we see an ad about how to manage our diabetes better? Does it mean it's an advertisement on how to manage depression? No. Health promotion really does mean, in terms of healthcare, self-care, health promotion truly means how do we promote and manage our own health in order to have a better and a healthier lifestyle and ways of living? How do we manage our health, both emotionally and physically, in order to prevent diseases and better control the outcome of our lives? How do we take our medication in order to further ensure that we have a better quality of life? And how do we truly engage with our providers? All of these are self-care. I know for some of us, it's natural to, have a headache or have a diagnosis and go to the doctor, take your medication, go for your labs. But for some other people, it's a challenge. And when it's a challenge and you're not engaging, then you're not practicing good self-care. So when we talk about the components of healthcare, like I talked about before, just even having a healthy hygiene is a form of healthcare. Imagine going to a restaurant and the restaurant has a grade of C. I'm sure a lot of us wouldn't go back there. That itself is a form of health hygiene, right? How do we practice health hygiene on a general level? That is not just us practicing health hygiene, that's somebody else also practicing it in a way that influences us. Another way that we practice health hygiene is making sure that we truly manage our medication, putting the medication in appropriate places, not putting it on the floor, or using it in ways that are not prescribed by the physician. The nutrition, the food we eat truly matters. I typically eat paleo. I've done this for about 10 years of my life. And when I eat sugar or when I eat high carbs, I tend to get tired and exhausted. And this is a diet plan that was given to me by a doctor when I found out I had some type of autoimmune issue. The doctor decided that the best nutrition for me was to stay away from sugar, which initially was challenging because I love chocolate. But as time went on, I got used to it. And now when I have food that has lots of sugar, I tend to get sick. So being able to manage healthy nutrition is a form of health self-care. So think about somebody who's diabetic. They will have challenges with self-care if they don't manage the type of food they take or the time of the day they eat, or even manage and check their blood sugar regularly. The lifestyle we engage in, I've seen people who love going to the beach, who love traveling, who love playing golf, but for some reason they always forget to use their sunblock. That's a form of self-care, not using something that is provided to help prevent a disease or a diagnosis could increase your chances of developing a form of condition or issue that you never planned for. Environmental factors can also affect self-care. So your social habits, your living condition. I personally am a night owl. I can stay up all day and go to bed at 2 o'clock. in the morning, wake up at 6, and you're ready to go. For some other people, that's not a healthy habit. So the living condition you create for yourself does not have to be what someone else's does, but it has to be something that works best for you. Living in an environment that promotes a healthy lifestyle, being able to go for runs when you choose to, being able to make sure you have a positive living environment, a healthy social economic factor. What type of cultural beliefs do you have? How does this impact your health? There's some cultural beliefs that believes if you're going to the doctor, you have to pray before you go and pray when you come back. I'm Nigerian by origin, and Nigerians are typically known to be very religious. So if you tell an average Nigerian that they have diabetes, the first thing they'll tell you is, in the name of God, I no longer have diabetes. And then they'll say, what does the doctor have to say? But they have to respond in a religious way before they would engage in whatever treatment the doctor gives them. Self-medication is another way of ensuring you have a positive self-care. So taking our multivitamins, I believe that's something COVID-19 has done, where a lot of us now are proactively taking multivitamins and doing everything we can to practice self-care in order to ensure that we can engage in a positive lifestyle and ensure that we're not part of the COVID-19 symptoms going on, or if we do have it, that our body's strong enough to fight it. So what are the core principles of self-care? Self-reliance, knowing who you are, knowing what you need to do for yourself. Like I talked about earlier on, I can function on a 4-hour sleep while some people need full 8 hours. Knowing how to empower yourself. About 10 years ago when I started exercising, I decided the best way to exercise was to wake up every morning and decide to take full advantage of the $30 I was paying the gym. So every morning when I wake up, I would tell myself, I don't feel like giving the owner of the gym extra money today, so I need to go use the money I paid for the gym. And I would show up at the gym and exercise for 10 minutes every morning. And my friends would laugh at me and say, what would 10 minutes do? But as I gradually knew my body, I realized all I really needed was 10, 15 minutes workout every single day. And 10 years later, that's really what I need. I've tried working out for an hour. I've tried working out for 2 hours. I enjoy that, but it really doesn't it gives me the same benefit of working out for 10, 15 minutes. So knowing what works for you, being able to empower yourself, give yourself a message, a mantra, whatever you need to do in order to have that autonomy, that individual autonomy, having that personal responsibility, knowing this is your health. When you're healthy, those around you are healthy. When you show up with a positive, healthy attitude, you're able to be part of a greater community. You're able to help those around you. You're able to function better in your networks and in your relationships. And you're able to provide your support system to your family and friends. I always use this as an example. When we see somebody who is rude or somebody who is not a very nice person, we tend to label them with different names, but maybe all they need is just more self-care, more sleep, take some multivitamin, more exercise. Exercise is known to boost your dopamine and serotonin levels, which makes you feel good. It could be that all they need is just to take more care of themselves and they'll be a better, more positive person. But because we tend to put other things above ourselves, it's hard to practice self-care. So self-care is easier. It's easier to encourage people to practice self-care, but it's challenging in reality to practice self-care, especially when we're typically used to taking care of other people instead of ourselves. So what are the long-term negligences of self-care? Stress. Stress, emotional and physical distress is one of the main obvious signs of lack of self-care. Seeing people being stressed out, you can hear people talk about being stressed out, you can see it on their faces, you can see it on the skin, you can see it sometimes the nails, the teeth, the hair. There are different ways stress impacts our lives. And once you have chronic and continuous stress, it could lead to burnout, it could lead to traumatization, it could lead to mental and physical health challenges. A lot of times when people go through stress, they often end up having burnout, which is some of the things we're hearing as a result of COVID-19. Emotional and physical exhaustion is typical example of burnout. Increased cynical and negative outlook in life, increased sense of accomplishment, decreased sense of accomplishment, frustration, irritability, feeling helpless, powerless, trapped, defeated. These are all signs of burnout. And how can we help somebody with a burnout? I once had a colleague who was going through a burnout, and she went to her boss to discuss the burnout and just plainly tell her boss, I'm going through a burnout. I need you to decrease my workload. And the boss was very supportive. And they continued the discussion for about 3 weeks. And at the end of the 3 weeks, the boss's response was, well, I know you have a burnout, but the work has to get done and you're responsible to do it. So of course, the employee felt defeated and helpless, and the employee made the decision to leave the company in order to take care of themselves. The boss reached out, tried to negotiate some more, and the suggestion for the boss was, you need to take a week off, go rest, go on vacation, and when you come back, you'll feel better. In this case, that's not true. How you recover from burnout, from exhaustion, from tiredness is really your responsibility, and what you need to survive really comes from you, not from somebody else. So in this case, the boss's response was not helpful because the employee truly needed what they needed was about 3 months off work, which is some of the things we're seeing as the result of COVID is the mass resignation of people due to burnout. Traumatization and post-traumatic stress disorder is another long-term effect of self-care. People having fatigue, intrusive thoughts, somatic complaints, distressing emotions, not being able to concentrate, having mental and physical challenges like anxiety, depression, difficulty concentrating, appetite changes. A lot of this negligence often leads to physical or mental health challenges and issues. And the World Health Organization and the National Institute for Health often correlate self-care and mental health. So prolonged negligence of self-care, prolonged shortness of insomnia or prolonged anxiety could lead to chronic mental illness. So not maintaining your self-care, not maintaining what you need to do to be healthy could lead to different types of physical and mental health issues, which in the long run will cost you more and affect your relationships and other things in your life. So what are the different forms of self-care? The first and the most common thing we hear is exercise. For some people, exercise is real, whilst for some people, exercise is just too challenging. So defining what your definition of exercise is matters. Self-care for everybody's different. So if you look at self-care for some people, it's going to Zumba class, it's going to Pilates, it's going to yoga. That's their form of exercise. Telling them to go to the gym and exercise and have cardio or lift weights for 15 to 30 minutes is a lot of work. For some people, eating healthy is challenging. They love whatever, they're a foodie. That's a regular word we all use around. But you can still be a foodie and regulate the quantity and the amount of food you eat. It all depends on what works best for you. Making sleep a priority. Some people need to sleep for 8 hours. Some people need to sleep for 3 hours a night. Trying a relaxing activity like massage, breathing exercises, journaling, meditation helps. Setting goals and priorities. I know my friends and I often laugh that at the beginning of the year, everybody sets the goal to lose weight and everybody goes to the gym. The gyms are typically crowded. And 1 month later, the gym goes back to normal. Only people who regularly exercise now go to the gym. So in reality, set goals and priorities that you can achieve. It could be just going to the gym once a week. It could be going to the gym once a month while you're exercising at home. For the longest time, I went to the gym every single day, 5 to 6 times a week, for about 30 minutes, 20 to 30 minutes a day. And about 2 years ago, I was tired of going to the gym. It became boring. So I decided to start exercising at home. I tried using YouTube. I tried using Amazon Prime and watching videos online. And I realized I got distracted watching other, movies or things on YouTube. So I decided to buy a portable DVD player and a couple of CDs, DVD players, and just exercise while using a DVD player. It's old-fashioned, but that was a way to avoid being distracted, and that has really paid off. Being able to set a gratitude mindset, being gratitude to others, being grateful to others is easy for us, but being grateful for ourselves is typically challenging. Imagine a mom who wakes up at 5 o'clock, has a couple of kids, takes care of them, goes to work, comes back, does laundry, cooks, clean, goes to bed. A mom like that should really give a gratitude for herself, for how much she's done, for being a good mom, for how much she has achieved for her family. So being grateful is not just being grateful for other things. There's a more positive effect when you're grateful for yourself. And then focusing on positivity. When you're stressed out, when you don't take care of yourself, it's easy to be negative and have negative thoughts. But when you can focus on positivity and take better care of yourself, you would see the positive aspect of it. I know a research was once completed where a professor and a group of students took a plant, and every day they would have sent positive thoughts to the plant. It was two plants, and every day they would send negative thoughts to another plant. The plant with the positive thoughts continued to thrive and grow and be greener and greener, while the plants with the negative thoughts ended up dying. So when you have positive thoughts, it ends up having positive effects on your health and on the health and relationship of those around you. So social engagement, this is something a lot of us has not done. We're not comfortable with, or we've decreased doing due to COVID. But being able to engage friends and family for social and emotional support is necessary and helpful in order to have positive healthcare. I once had a group of colleagues where if we go to a meeting and one of us uh, is off, and when I say off, I mean snaps or talks in a tone that is not friendly, then after the meeting, everybody would go knock at the person's door and say, "Are you okay? Your tone is not okay, or your tone was a little harsh. Is there something going on?" And that's because we had a meeting where we gave each other permission to hold each other accountable to be healthy and positive at work. And that engagement was just very beneficial and helped increase positive health environments for everybody. Other practices like massage therapy, playing music, dancing, reading, are known practices that also helps with self-care. I have quite a few friends who on a weekly basis go for massage, or a monthly basis go for massages, and after that they just feel exceptionally positive and ready to take on the world. So how do we integrate self-care into our daily practices? We have to make time for ourselves. We always say there's no time, which is true. We're all busy, there's no time. But when you don't make time and something happens to your health, then there'll be time. So being able to prioritize ourselves and make time for ourselves, make the self-care about something you enjoy. Take care of yourself physically and spiritually, create a healthy and personal boundaries, being able to say no to unhealthy work environments or unhealthy work schedule, and then engaging and socializing with friends and family. And the benefits of self-care, of course, is a better quality of life, good health, healthy relationships, increased happiness, positive mindset, and having job and life satisfaction. So like we had talked earlier on, what is the proactive way of achieving self-care? Because sometimes we only achieve self-care after something drastic has happened in our lives. One of the easy way to achieve self-care includes completing your yearly physical exam, engaging in using wellness application. If you've heard of Empower is a wellness application where you can take an assessment, and the assessment tells you about your stress level, about what you're going through. And based on the assessment, activities like yoga, meditation, exercise can be created for you to help you proactively manage your self-care. And of course, you can use wearable devices. If you have a wearable device that tells you about your blood pressure, what's going on with your blood pressure, how to better manage your blood pressure, you can see if your blood pressure is increasing or if it's decreasing. I have a wearable device where I had traveled to a certain part of the country a few months ago. And between 12 p.m. and 2 p.m. every day, my blood pressure would go up by 5 points. And typically, I suffer from low blood pressure. So I went to the doctor. The doctor didn't see anything wrong with that, but I kept documenting, trying to see why my blood pressure was going up so I can take steps to make sure that doesn't happen again. Unfortunately, we couldn't find out what was going on, so we just decided it was the trip that caused it. Being able to engage with your physician. So just like the example I gave about myself, if you have a wearable device or you're using a wellness application, or if you take a wellness exam or you feel something is wrong, being able to engage with your physician is one of the most important ways of proactive self-care. So when we talk about proactive self-care and we talk about population health management, what does population health management means? And how can we manage the health of a population to ensure we get positive healthcare outcomes? One of those ways is accountability of time at home, reflections, ensuring that each individual have a way of measuring stress. I have a friend who her way of measuring stress is when she loses her temper with her kids or she raises her voice with her kids, then she knows her stress level has gone up and she immediately takes action to make sure she doesn't do that again. For other people, it's a good night's sleep. It's engaging with continuous support. It's using resources available to us through our EAPs and wellness apps. Avoiding email supervisions. Some supervisors love to send long emails, or some people love checking emails outside of work. These are all ways that we can decrease and try to improve our health. So when we try to improve our health, of course, population health management, like I talked about, is when a provider helps you develop steps to improve your health. These are known as interventions. So if you're diabetic, for example, and your provider comes in and tells you you have to check your blood sugar every day, and when you check your blood sugar, you document it, and these are the food you eat. When the patient chooses to engage, this is known as patient engagement or person engagement, it leads to better care. And when the person engages in their care, including self-care, this leads to better interventions for the provider and better healthcare outcomes. And when we have these better healthcare outcomes, then we have a better overall population health management. So I'll turn this over to my colleague Ray to talk a little bit more about population health management and how these interventions can better our value-based payment arrangements and improve care outcomes. Back to you, Ray.
Thank you so much, Dr. Ronke. Excuse me. So first, you have really shed some light on what counts as self-care because we hear that all the time, and it's not this fluff concept of, eat, pray, love, or whatever other books that are going around that have it very focused on the individual. Population health gets to the level of groups of care for individuals, but it really talks about all of us in our communities and how we are having different health outcomes or what we call different health effects. So, how prevalent or how often do you see that in community? What are the types of people that have those conditions? And what are the types of things that we see happen over and over? That's really population health. And then the management piece of it comes into play when we're talking about how do we make sure that people are living their best life, whatever conditions they may have. That means something different as you've spoken of for you. It may mean something different for me. But what are the ways in which we can track and look at who's able to live their best lives and their healthiest lives and who are not? And how can we stop what has seen occurring in different communities, those inequities of being able to have that. So the patterns of what we see in the community are just as important as what we see as individuals. And I would love to shed more light on that, but I do want to kind of get your thoughts as we continue this dialogue around where's the intersection of self-care and population health management. And I do want to take into account, there's all these big words, value-based care and all of those things that we look at. Let's bring it down to the most basic level. When I go to a provider, when I engage in health, whether it's food or looking at things from a safety perspective, I'm looking at that very critically. Is it safe for me to walk? Is the food I'm eating safe? Is the air I'm looking at something that I can breathe and nourishes my body? Those are the things that I'm looking at. So from that perspective, this concept of value-based care, a lot of times there's money involved. the provider that I go to, the food that I use, the place that I live. Money is that common denominator between all of those. And are you getting the best value as a consumer, whether you're a patient or a consumer in any other context, for the outcomes that you're seeing? So that's what value-based care really is driven and driving towards. It's making sure that when you go see your doctor or when you go see your nurse practitioner, you're being sure to get the best value and they're taking care of you the best way that they can. And that's really as simple and basic as it gets. Oftentimes, we see that members may not feel that they're getting that in the community. And how can we make sure that they're seeing that more often, as well as tracking those outcomes to live their best lives? So I wanted to touch on that just for a moment before we kind of switch gears.
Absolutely. Thank you, Ray. So when we talk about outcomes, I think from a healthcare provider and a health system perspective, we understand what we mean by healthcare outcomes. But from a patient perspective, not a lot of patients understand what we mean by healthcare outcomes, but patients do understand what it means to have better health. So can you discuss how we can promote self-activities to help decrease cost and improve better quality of life, and the definition of healthcare outcomes for patients or individuals?
Certainly. So when you're talking about an individual level, the health outcome is, am I feeling good today? Do I feel as if I have a sickness that is preventing me from living life to the fullest? Whether it's taking care of my grandchildren, if that's your life, whether it's traveling the world, if that's your life, whether it's having time to, go to work, even feeling capable of working or existing in the spaces that we choose to be on an individual level, that's the barometer of health as a patient. When you're looking at it from the standpoint of your barometer of health from a health system, it's, are we having patients come to the hospital? Do they have more visits than what they need to have for the conditions that they are, living with right now? That's the health systems and a health payer perspective of a health outcome. Do we have people coming into the ED because of conditions that they have? So, you know, those are all the different ways health as an individual level and health from a health payer or health system level. Those are the differences and nuances. But the basic function is, are you engaging with a healthcare provider? That's kind of the intersection between the two. And how can you minimize those interactions appropriately so that you're not having to sit down with your doctor every time something is, going crazy, because you're not having those effects happen to you. So what are the ways in which we can, kind of prevent that? It's multifold. Self-care, when you're talking about, I was thinking about and taking notes when you were speaking, self-care, it's from a psychological standpoint, a social, emotional, a physical, and spiritual. Those are the categories that falls under whatever activity that you're doing. And it's based off of what you value. And we value things based off the communities we're a part of. Self-care and population health is really helping to promote or helping to help others engage in the behaviors that they value that lead to the self-care activity that keeps their health intact, or it makes it, whatever condition they have, not detrimental to them. They can live their life to the fullest. So from my perspective, these are things, yes, you can tell a diabetic that they need to check their sugar levels or glucose levels every day, but are you providing healthy foods? Because they can check it, but if they're not having the nourishing foods that really feed into their body in the way that they need, then you're just sending them a reminder that they're not in the healthiest condition that they want to. So you have to pair that with support for them. Are any other category like high blood pressure or anything else, do they have the ability to exercise? Is it safe? Is it affordable? Population health management looks at that for groups of people. And on the payer side, we're seeing more and more where the health payers, particularly the government payers like Medicare and Medicaid, are diving into that field to state, we understand what happens in the four walls of the hospital are not all of encompassing of what happens in your life. And that many times you end up within those four walls because of what's happening on the outside, and your ability to have access, affordability, equity, and just the chance to engage in those healthy behaviors within the context. So how can we do that differently? One, we have to measure differently. It's not just based off of how much can you save the health system or the health payer? It's based off of how much health are you on an individual level and on a group level realizing? How healthy are the populations from all age ranges? That's one of the ways in which we can do that. The other way is to really incentivize our health system and our patients and community members to engage in those behaviors and supporting that pathway. So sometimes that means we're going to have to invest dollars in the community. If the neighborhood's not safe to walk in and that's your easiest pathway from affordability and consistency to exercise, then that's what we have to support. And there's different ways that you're seeing that. And this discussion is going on all around the nation, from health payers to governments to communities. We're all asking for that same thing based off of our values. So it's very critical that we're speaking similarly, not the same language, but similarly enough that we can make an impact.
That's great. Thank you, Ray. I love the way you talked about being able to talk to the patient in the way the patient can understand in terms of healthcare outcomes, and being able to provide the resources necessary to ensure the patient can engage in interventions to result in positive self-care and care outcomes. So in terms of the resources, how can we help patients measure a successful healthcare outcomes? You had talked about what it looks like for everybody, but when we have patients who have pre-existing conditions like diabetes, how can we help them create a different outlook and better way of measuring their healthcare outcomes?
Well, part of this is having a discussion around what are the goals of health for the patient in individual and group level, and then having a realistic perspective of what are the goals of health for that patient population as a group. Because, when I say goals of outcome, that includes, do you want to have the energy to go to a cruise? And what does that look like for you? Do you want to have the ability to have your stress levels managed to a way in which you have more days often than not that you're present, active, and there for your family and your friends? That may be goals and an outcome that our patients want. And the way to get to that is tracking energy levels based off of the foods you're ingesting. In the diabetic example, tracking the amount of times that you have days where your levels are out of range for you on a personal level, and what are the ways in which you're taking steps to mitigate that. So those are the ways on an individual level that we can help reach that goal of health and goal of care that the patient is looking for. On a group level, it's supporting the tools for the health system or the health payer to engage with members on that. So if I know this seems to be a theme, everyone this time of year is on some form of a diet from excesses over the holiday period. So if that's what you have, then maybe your kind of proportion control, nutrition, exercise physiologist, all of these different layers are front loaded at the beginning of the year for our patients. Like, hey, we have all of these different things available. Do you want to join? Because that's at the moment that they're engaged and activated based off of what's of value to them at that time. And that's being sensitive to that. It's just like you've seen all of the rash of exercise gear in all the different colors. It's ready to go for the spring season. I mean, right as soon as December 26th happened, they were rolling it out. Well, we can do the same thing in healthcare. The retailers and other industries are very attuned to cyclical nature of group level thinking based off of what cultures they're around. Healthcare can have the same thing, taking advantage of Lunar New Year or other events to highlight and promote health to specific communities in the ways that they value. That's a way that we can have it at a group level for that goal of care concept or goal of health concept.
Yeah, that's great. Thank you, Ray. I love the way you summarize this in terms of a patient perspective. But let's talk about the reality of this from another angle. Social determinants of health are things that we know impact a patient's healthcare outcomes and ability to engage in health interventions. So when we talk about social determinants of health, for those who are not aware, we're talking about the socioeconomic factors like culture, education, location, access to food and water, access to basic life amenities that if you have this access, then you can follow up with your health. Somebody who's homeless is not thinking about seeing their doctor, right? They're thinking about what food are they going to eat, where they're going to take a shower, how do they get home. So how do we help address social determinants of health in terms of self-care and in terms of population health management?
Well, when you're looking at it from a population, I mean, you've hit on one of the things that are the greatest challenges of our time and that we're trying to address in new ways. So social determinants of health, let's start with the category of safety. If you do not feel safe, that's your primary concern. It takes precedence over all else. So the fact that you have a comorbid condition is a backseat to that. Now, excuse me, depending on your level of safety, if you're in an acute, right now, immediate danger, that's going to take precedence over anything else. But if you're not in that particular constant state, then everything else is prioritized after that. So the first thing that we'd have to support are community groups who promote safety. So that's going to be our intimate partner connection locations that we have, our housing location for transitional and those that support our transient population or homeless population, and some of the ways in which they help people find shelter. You have to address that first. And there are community groups, there are health plans, they're all engaging each other with an investment of dollars, time, or commitment for those direct resources. And that has to be handled first because that is the first layer of self-care. Food, water, shelter, basic safety, those are the things, and clean air are the 5 categories that you have to get to the other layers of healthcare and self-care. They in themselves in that moment become self-care. And so a recognition by all of us that that is important and that it may not look the same way for every community member, or that there are others that may be more likely to not have that. I'm thinking of veteran populations that suffer from homelessness and maybe some of our LGBTQ plus community. You got to tackle that first for them. And I think health plans now are starting to recognize that that also means if you tackle that, there's less likelihood that you're going to see on the back end this connection or engagement with patients going to the healthcare system. Because you can become a patient when you need something to help you because your health has been altered. That's when you become a patient, but you're always a person. And we have to get to the holistic person outlook of health first before we even come over to the second section of dealing with people as a patient. And a lot of times, if we tackle those, and it's an investment of dollars and time and people, those are the most valuable resources that you can invest in that space. And a lot of that is population health management. Some of it may even cross into the public health space, which is a very specific focus, but that's how we tackle that to support people.
Thank you, Ray. I love the way you talk about holistic interventions. And when we talk about holistic interventions, for those who are not aware, it's really treating the body and the mind, right? How do we address wellness from an emotional perspective, making sure that those around us have emotional well-being? We had talked about stress earlier on. We talked about burnout and how to address stress and burnout. And when we don't address this, how this could lead to physical and mental health challenges, and in some cases, mental health challenges like anxiety and depression. So, Ray, when we talk about population health management in terms of a holistic view, how often do we see diagnoses like anxiety and depression impact population health and patients' ability to follow up with care?
I would say it's quite prevalent. They coexist. I mean, oftentimes you're looking at a chicken and an egg scenario. The condition can happen first, and then the anxiety or depression or other adverse moments and mental health concerns come from the condition and kind of the preconditions or the environment that really led to that condition. Other times it could be the mental health condition itself. So anxiety leading to lack of your physical health being at its optimal for you. So you see those happen pretty regularly for a population health perspective. I mean, it's known that, oncology patients have where, because of the diagnosis, where they have negative thoughts, maybe even depression while going through treatment. And so that patient population is a great example of maybe they may have had mental health needs before, but it's an acute, immediate need that comes about because of the medical condition first. And then it, cascades from there. But let's talk about upstream, all of the things that may contribute to them needing oncology care. So when you're talking about population health and whether or not mental health is a part of that or a separate component, it's hand in hand. You can't really separate that out. Our patients, our community members, ourselves, at some point, you're going to have to acknowledge the challenges around the medical conditions and the kind of interlinked continuum between them.
Absolutely. I completely believe in wellness and using preventative and proactive measures to wellness. And I love a lot of mental health applications out there now have artificial intelligence that backs them up, that helps you to quickly detect if a person has a potential issue for depression or anxiety. So let's say somebody who has cancer, for example, and does not suffer from depression or anxiety, continuously you taking assessment from a wellness app or using wearable devices can help tell if your blood pressure goes up when it's time to go, for chemo, or when you come back from your chemo, and being able to take approaches to help manage that. Because really having mental health is not just about having anxiety and depression. It's really about the clinical longevity of these symptoms that really matters, right?
Absolutely.
We've all had anxiety before an exam, right? We've all had anxiety before maybe one or two major life issues, maybe for about 1 or 2 minutes, or in some cases for some people for an hour, for some people for a day or two. It all depends. So not all mental health issues are mental health disorders, right? It really depends on if you had the continuous symptoms for 2 weeks or more. And if you notice you're beginning to have those symptoms, what steps are you taking, which is the self-care? What steps are you taking to mitigate that so it doesn't become a disorder, so it doesn't become a diagnosis, right? If you wake up in the morning and you realize, I have a particular friend where every Sunday in the morning, he's super happy. Once it's 6 p.m. on Sunday, he falls into depression because he doesn't want to go to work. And he loves his job, but it's because he has to go to a certain meeting on Monday morning. And there's nothing you can do to help mitigate that depression. But he does have the power to mitigate the depression, but he's just filled with so much stress and anxiety that he's not able to empower himself, which is one of the core components of self-care, to mitigate those issues. And that causes him to have anxiety or depression, sometimes anxiety and depression before Monday comes in. So being able to monitor and being able to be self-aware and say, okay, here's the pattern I'm noticing. What steps do I take on Sunday to make sure that doesn't happen? Do I meditate? Do I journal? Do I listen to some affirmations? Do I go watch a game? Do I go to a friend's house and go play a game, or just something to distract myself? So when it's time for bed, I just go to bed, wake up in the morning, it's time for work. What activities and actions can I take to mitigate that anxiety and depression before it becomes a disorder? Or if you already have that disorder, what activities can you take to ensure it doesn't become a chronic condition? And if it's already a chronic condition, what steps can you take to help manage it so you have a better quality of life? So I just gave 3 different definitions of self-care, right? So self-care for everybody, like you said earlier on, could mean different things at different times. So Ray, as we're rounding up, in terms of value-based payment, what can providers do in terms of interventions to help engage patients in better self-care?
There's a lot that providers can do. I would argue that it's not all on the backs of providers. When you're talking about value-based payment, it's value to whom? In this instance, it's value ultimately to the patient. And so providers are going to tackle the medical specialty and medical conditions that they have. But what they often lack are really clear ways to activate the patient, to actually take action on what helps them mitigate in their own personal life. And from a group level perspective, if you're having that with one patient and then it turns into 100, then it turns into 1,000, and then it turns into millions of patients, that one provider's impact may be diluted. So the first thing is it's not all on the providers for this. Some of this requires the health plans or the health systems to support providers as a group, to have resources for the community, to have resources for their patients to engage in self-care. So that's one. The second thing is that a level of accountability for providers has to be built in that's sensitive to where they are now. We are having providers that are themselves experiencing burnout and experiencing so many other things and challenges within their own personal lives and within the workspace that to make it the easy button for them to engage patients around population health needs and self-care needs is the best way to have everyone happy and also to have it effective, right? So for providers, it's not just that you give them a list and say, if your patient comes in and they state they need food, here's a list of resources. It's helping them be able to know that someone is available for them to hand that patient off, whether it's by a virtual option, whether it's by a self-service option from a website in a chat room where patients can engage directly. That's what the providers need, because they're not just recommending their patients do something that's not going to impact their lives, right? They're wanting an action to go on themselves, and the providers have that mindset. The other thing to think about is our patients and what they state that they need. So just because you may feel that self-care for that patient is food security, and then that patient brings up transportation is really the challenge for them, you have to pivot to what they know is best for their life, but recognize that scale is how you get that for them. So if one patient has a transportation issue and it's maybe, from a priority list, number 7, and number 1 is something else, but then you keep seeing patients have that on the list at all, that means that the provider needs a link to transportation as a way of self-care for those patients. And those are all ways in which you help the providers and you help the patients, but you have to meet people where they are. You can't dictate it to them. It's an engaging process with a dialogue of back and forth. You also can't require that one side is held to a standard and another side is not, whether it's on the patient's end and putting everything on accountability for the patient, or on the provider's end and making sure that they check some boxes that you've taken care of getting vital signs for a patient and thinking that counts as self-care. That's not going to work. And, we are now beginning to recognize that what works and is effective is that we engage in this together from a patient, provider, and payer perspective, and do it consistently around measures that we all can find important. So looking at social determinants of health, looking at health inequities, looking at what truly costs the most for the health systems, the health payers, and the patients, and that affordability piece of it. Those are the things that really, that nexus of where we all agree we need to make changes and take action, and then walking that path together. That's where we get to the self-care and the goals of health at a group level as well as an individual level.
Absolutely, Ray. Thank you so much, Ray. I really love your perspective about population health and self-care and how to engage patients to better care for themselves in order to improve their own individual health and help improve population health in general. This concludes our webinar today. Thank you so much for joining us. We will be sending out the recording and the contact information for Ray and myself in UB Health. If you have further questions, feel free to email us and we'll be more than happy to respond and get back to you. Thank you so much and have a great rest of your day. Thank you.